So tonight, we are going to be celebrating Good Night Lights, which is a wonderful tradition where members of the community flash lights at Hasbro Children's Hospital, and we flash them back to acknowledge the community's relationship with the hospital and with the children and the other patients that we care for. But tonight's Good Night Lights is a little different. We're celebrating the achievements and accomplishments of the 14th Field Hospital team that came to help us out at the height of the pandemic. 6 weeks ago, a group of 26 military health personnel came like the cavalry to help us when we were at our most dire. They rode over the hill on their planes and cars and however else they got here, and they worked side by side, shoulder to shoulder with our teams, providing respite and help. They provided incredible expertise in our critical care areas for both adult and pediatrics, in the emergency department, and also in our pulmonary critical care service. They were an enormous help. We're going to miss them dearly, and we are so grateful for the service that they provided to our patients, to our staff, and to our community. And with that, let me introduce Lieutenant Colonel Ramirez.
Hey, good afternoon. So we, the 14th Field Hospital and the Rhode Island Medium Medical Team, we are extremely honored, and it has been a pleasure to be part of the Rhode Island Medical Team. I think each one of our providers and nurses, we all went through these unique experiences, and we are so glad that we were able to provide some of our expertise in this needed medical care to the community here at Rhode Island. We are extremely grateful for the warm reception from the Rhode Island Hospital and also from the Rhode Island community who received us here. They made us part of the family. Here in the hospital, we became one team, and we were able to provide these life-saving measures and our expertise to the local community. It was great to support the NORTHCOM mission and the FEMA mission here at Rhode Island. We are extremely excited for our accomplishments and what my team of healthcare professionals and nurses and respiratory therapists, what we did here at the hospital. It has been an honor. It has been a great experience, and I'm open for any questions.
Because of this, what difference did it make over the last 6 or so weeks here? When they came, you guys were in pretty dire straits.
Oh, it was extremely challenging at the time. It was really the peak of the pandemic. We had over 175 COVID-positive patients in the hospital. We had over 300 staff members who were out ill. And what it allowed us to do was to open up additional critical care beds and to provide some relief to staff who'd been working extraordinary hours. So it really helped us get over the hump. Part of the constraint that we had was the limited number of staffed critical care beds, and this provided a measure of relief for us.
And so you measure it in wait times, like how?
Well, there have been a number of changes that have occurred over the last couple months, or last month and a half, really. We're down to a little over 30 COVID patients, down from 175. At one point, we had 300 staff members out with COVID-related illnesses. This week, it was about 10. So there's been a dramatic change. I think it's probably been felt most acutely in the emergency department because backups on the inpatient side result in waiting in the emergency department. We were boarding between 30 and 50 patients a night in the ED. Over the last 2 weeks, it's been under 10. So it's been a big change. The waiting times have gone from 6-7 hours to much shorter. So patients are feeling this acutely, and it's large part due to the downswing of the Omicron peak, but we couldn't have gotten there without the help of the military team.
Doctor, those numbers you're giving us is comparison to when they arrived and now?
Yes,
or,
that's correct.
So pretty significant changes.
Oh, the fall off is almost as dramatic as the rise, and I think it has to do a lot with the dynamics of the pandemic itself.
Colonel, any unique circumstances or anything your team was surprised to find, or just anything out of the ordinary?
No, not really. Our team was ready. They are trained. They are healthcare professionals, just like their civilian counterparts, and they were ready to answer to whatever and respond to whatever situation they found here. And I think they rised up to the occasion and they executed beautifully.
We've seen the good night lights, I take it.
Yes, definitely. The whole team will be here tonight at 8:30 to watch the Friday Night
Have you
Lights.
seen it?
I have not seen it
Oh,
yet,
okay.
so we're excited to be here, and we'll see how it goes.
When do you officially leave?
So right now we will do our last clinicals this weekend. We will be working all the way up to the 6th, and then we'll do a day of out processing and making sure that everything is closed out here at the hospital before we leave. And then around Monday, Tuesday timeframe, we'll be heading back to our 7 different posts where all my nurses and providers are coming from.
Do you have another mission ahead of you that you're aware of?
I'm not aware of any mission, but we are the military, so we're always getting ready for whatever is next. And
You had mentioned something about 30 COVID patients.
Correct.
Is that at Rhode Island Hospital now?
At Rhode Island and Hasbro, I think the number this morning was 34 altogether. Yeah, it's important to distinguish new cases from convalescent cases. After 10 days, COVID patients are not considered infectious in general, and so we have, trying to remember the number, I think it's under 10 fresh cases in the last 10 days, and the rest are convalescent.
Are more manageable at this stage?
It's much more manageable. I mean, it's still very challenging. We were not in a great place back in the beginning of November because of the nursing staffing challenge and the general staffing challenge. We have about 80 beds out of circulation just because we can't staff them. But that being said, we're not having the same degree of extended assignments, people having to work overtime. I mean, it's manageable at this point.
How many kids are hospitalized?
Altogether,
Yeah, right, for COVID.
oh, for COVID, I can't recall if it's 5 or 6 today.
At this point, we're kind of moving into endemic strategies.
Mhm.
We talked about that this
Yeah.
morning with the Department of Health, and then this is reflected in the new CDC guidance. How is that changing things at Rhode Island Hospital? I know that there's been changes in their policies.
Exactly. So we changed visitor policy just in the last few days. The infectious disease and infection control teams are assessing regularly. We are now at a level yellow, down from a level orange and red. And the question is, when do we go to green? My expectation is over the next week or so, we're likely to allow staff to have indoor meetings without masks, that kind of thing. But I expect that we'll be continuing to keep masks on in clinical care areas for a long period of time. Some of the other changes will be around preoperative testing and pre-admission testing. So all that is evolving, and they're following the data closely, and expect that our level of protections and protocols will be revised in the next week or so.
Do you have a plan in place?
I'm sorry?
Are you more nervous or excited about this shift?
Yes.
Do you have a plan in place should we see another surge?
You know, as Lieutenant Colonel Ramirez mentioned, we know how to do this. And, you know, the first time the roof leaks, you run around, you figure out where the buckets are. The second time you know where the buckets are, the third time you've repaved the roof. So it feels to me like this is well in our wheelhouse. And the critical thing for us is to continue to be updated on evolving strategies and the use of antivirals and other therapies that come along. But we know how to deal with the surge. We know how to deal with warm and cold units. We know how to protect ourselves with PPE. So this is becoming part of our repertoire. Thank you for the question.
I'm sorry, I was a little bit late, but do you think with the teams leaving, are you going to struggle at all with staffing now? Are you concerned at all about the gap that's going to mean?
So we are. You know, we expect that we may need to close a bed or two over the weekend because we think that staffing will be a little bit tighter. We are able to project out over the next month or so, and there's been some increased availability of contract labor, and our projections are that we'll be able to compensate over the next week or so, and that we'll be at a pretty steady staffing level.
And how long is the guard going to be here for? What's the notice?
Oh, good question. I think their current assignment was 4 to 6 weeks. I'm not sure how far into that we are, so they're going to be around for a little while longer. They're doing non-clinically facing roles, and that's been helpful in areas like supply chain and nursing staffing.
How short-staffed are you at this point? We know that you are short-staffed, not
Yeah.
as bad as a couple
Yeah.
months ago?
Yeah, so it's a challenge. Every organization runs with a certain vacancy rate because there's expected turnover of staff who move on to other assignments and new positions and so forth. We've been running about double the normal vacancy rate. So we have around 600 additional positions vacant than we would normally have. We normally employ about 7,000 employees. So it's challenging. It depends on the unit, depends on the profession. On many of the nursing units we're running between 15 and 25% vacancy, something like that.
7,000 between the two, or in the whole group of lifespan?
For Rhode Island hospitals, it's about 7,000. Lifespan's about 15,000 employees. Yeah.
So, Lieutenant Colonel, I'm sorry, but have you been to Rhode Island? Where are you based out of? And have you ever been to Rhode Island? What was your impression?
So
being here and-
we are stationed out of Fort Stewart, Georgia, which is a little warmer weather than here, Rhode Island. Overall, our experience has been amazing. From staying at the hotel and the community receiving us, and we walk around and we have the Rhode Island community thanking us for our service and thanking us for being here and helping the community with the COVID. It has been a great experience. We love the city. We love the food.
What in
especially-
particular?
Italian food, Federal Hill, yes, awesome. So we truly enjoyed that. It was a different experience for a lot of us, and it was great. Thank you.